Morning. Welcome to Thurston County Board of County Commissioners agenda setting work session for Tuesday, January 12th, 2021. My name is Ty Menser, Chair of the Board. We have Vice Chair Commissioner Gary Edwards and Commissioner Carolina Mejia, as well as County Manager Ramiro Chavez, Clerk of the Board Amy Davis, and a cast of characters here from different departments that will be calling on at different points in the meeting. If for public attendance, you may follow along on the Thurston County YouTube channel. Almost all of our meetings are live streamed there and also can be joined by phone at 360-252-9020, PIN 1234. And we also have opened up the boardroom as of last week, I believe it was, back to kind of the pre-November status. Limited capacity, masking, distancing, but there is the ability to appear in person at the board meetings. We're going to start, as we do, with a couple of weekly items. The first is our COVID-19 update. We have Director of Public Health and Social Services, Shelley Slaughter. Ramiro, should I go right to Shelley?
Commissioner, if I may, for the public's benefit, this meeting is going to end at about 11:15 because you have other matters to attend. So.
Yep, that's right. Thank you. Go ahead, Shelley.
Good morning, Commissioners. Dr. Nimiana Abdamalik, our health officer, is attending an important vaccine meeting today, so I will be providing the report and answering any questions that you have. So as of yesterday, in Washington State, 289,939 confirmed cases of COVID-19 have occurred in the last year, with 3,903 Washingtonians who have lost their lives, including 61 here in Thurston County that have lost their lives, with 3 of those deaths occurring in the last week. Our current cases in Thurston County to date are 5,829 confirmed cases. That puts our rate over 14 days for our population at 257.91. 326 Thurston County residents have been hospitalized to date, with 4 hospitalizations occurring in the last week. Our positivity rate for testing for COVID-19 has risen to 10% this week. To date, we've had 42 outbreaks in congregate care facilities, 6 that we are currently investigating, and 2 that occurred in the last week, including in our Thurston County Correctional Facility. In our local Thurston County hospitals, 90% of all beds are occupied at this time. 16% of those beds are occupied by COVID positive patients, and 20% of ICU beds are occupied by COVID patients. We are part of the Western region per Governor Inslee's new roadmap to recovery that was unveiled. That includes not only Thurston County, but also Lewis County, Grays Harbor, and Pacific counties. And I just want to share what the latest metrics are for our region as of Friday. Each Friday, I now receive a report from Washington State Department of Health, letting us know how we're performing on 4 key metrics that are used to determine whether counties can move on to phase 2. We are currently in phase 1, as is the rest of Washington State. We did see some improvements in this last week, in this last week. Our trends are decreasing in terms of our COVID cases rate. Again, keep in mind that there is a 1 to 2 week data delay. Our hospital new admissions are flattening, and our average ICU capacity is at 82%, with our 7-day testing capacity, testing positivity at 8%. Again, there is a data delay on that, but I will be regularly sharing that information for you, and it's also available on our website. I want to shift gears really quickly and share good news about vaccines. We are diligently working on our vaccine planning and administration. As of yesterday, Governor Inslee made an announcement that effective immediately, we are now in phase 1B1. That is tier 1 of phase 1B. So that means that anyone over age 65 is eligible to receive a COVID vaccine, and people living in multi-generational households. I've received a lot of questions about what multi-generational household means, and the intent behind Department of Health's prioritizing people living in multi-generational households is for those that are living with an older adult or an elder person that they are providing care for, or that person is providing care for another member of the household, such as a child. It is also intended for those who are providing care to an older adult or elder who is not in a long-term care facility or adult family home. The intent is not for multi-generational households where there is a healthy 50-plus parent that is caring for their own child. So there's more information about that, and I expect that the definitions will hopefully be updated in the Washington State Department of Health website, but just wanted to update you on that. In Thurston County, this is as of last week, we have our Thurston County facilities, of which there are 12 currently authorized to receive and distribute vaccine. 9,450 doses have been received. 5,388 Thurston County residents have received COVID-19 vaccines. They may have received those in other counties. We continue to work with Washington State Department of Health to refine that reporting. We believe that about 57% of our vaccine in Thurston County has been administered with either first or second doses, and we expect to fully expend that allocation at all facilities by the end of this week. Supply chain is unknown at this time in terms of continuing to get adequate vaccine supply in Washington State and in Thurston County, but we'll be working on that, and I'll be providing updated reports throughout the week. And finally, Thurston County Public Health and Social Services is working with our local partners to plan for mass vaccination events and clinics. We intend to have two fixed permanent sites, as well as multiple mobile sites and events in locations throughout Thurston County. We are exploring potential sites and expect to have those announced later this week. And they will be geographically diverse in where they are and easily accessible to people. We expect to be administering our target goal of 1,000 doses per day, starting in the beginning of February, with additional new clinics, mobile clinics, beginning this week. And that concludes my report. I'm happy to answer any questions that you have.
Questions for Shelley? I'll start with Carolina Mejia.
Yes, Chair. Shelley, I do have a question. I just wasn't able to catch the number of vaccinations that we've given out here in Thurston County.
The number that I shared was 5,388 Thurston County residents have received COVID-19 vaccine. They may have received those doses in other counties. And our Thurston County facilities have received 9,450. So we don't know at this time how many of those 9,450 doses have been distributed that are in Thurston County, but we do know 5,388 Thurston County residents have received.
Okay. With the regulations that came out, the new rules that came out yesterday with the governor's new order, can you tell me what your expectations are as we're moving into this new phase, and just for general information for the public. Things that we should be aware of and hold on for, information that we should look out for.
Yes, one of the main things that I would like the public to know is if they are curious about whether they are eligible to get a COVID-19 vaccine now or at a later time, they can visit www.findyourphase.org. There is a short questionnaire that asks you a series of questions. If you qualify in the current phase, you will receive a link to current places that have vaccine in your county where you put your zip code in. Sorry, my apologies. So I encourage people to check out findyourphase.org. I also wanted to share that those in phase 1A, so those that are healthcare providers and medical first responders, can still get COVID-19 vaccine. Just because we are now at phase 1B1 does not mean that you still are not top priority. And this week, Thurston County Public Health and Social Services will be continuing our last week of giving out vouchers. So anyone that is in phase 1A can get a voucher by visiting our Thurston County website and filling out some information and taking that to a provider that has vaccine. You can also show a screenshot or printout of your Find Your Phase eligibility. And finally, I would say I know everyone is very anxious to get the vaccine. We're very excited. We want to get as many people vaccinated as quickly as possible in our community. Currently in Thurston County, we do have enough supply, but I think a lot of our providers are going to be quite overwhelmed today with the demand. So we ask for everybody's patience as we prepare and scale up to meet all of the needs.
Okay. Thank you.
Commissioner Edwards.
Yes, Shelley, do we have any of the county's injection sites set up yet so citizens can go directly to that location?
Our Thurston County Public Health sites are not yet open to the public, not yet open. We expect to have those in next week.
Okay, so now a citizen that's concerned out there could go to our Thurston County website, and I'm hoping that right there when you check into that website, it's got a place to click on getting a vaccine rather than know a particular phrase to type in or something. Is there something very simple for people that are not familiar with the net process? Once they get to the page, there's a place to click on, and that'll give them all the direction they need.
Yes. By visiting our Thurston County website is the best way to get information today. And there is information that's clear about phases, clicking on the link if you need a voucher, and where you can find vaccine right now in Thurston County.
And I'm holding up our, that blue sheet you gave out a couple of weeks ago with the phases on it, A1, B1, B2, that kind of thing. Have there been any changes there for the school teachers?
Washington State Department of Health did not make any changes to that specifically. However, in phases B1, tiers 2 through 4, there is additional flexibility that we have in terms of being able to get those who are under age 50 and those over age 50 vaccinated in groups. And so that should help us to be able to get, for example, our educators vaccinated more efficiently.
By any chance, are you going to have a special clinic for educators that the health department will put on? Because most of those folks are in good physical condition, I guess, and probably don't have a health care provider right at the drop of a hat.
Yes, we will be. We are partnering with our local school districts to set up vaccination sites. So each of the school districts has offered a site for the most part high schools in which we'll be scheduling special clinics targeted to specific populations. And we'll be sharing more information about that as we finalize things in the next week or two.
Do you have any estimate on the time frame that we will be implementing something like that, or we'll be completing it? But at least when are we going to start that?
According to the latest direction that we have from the governor, the first goal is to get phase 1B1, so the over age 65 and the people in multi-generational households. And we want to at least get 50% of those before we will be able to move on to the next phase. And Governor Inslee will be the one that will be announcing when Washington State can move on to that next tier in phase B. So we'll be looking for that. I would anticipate that would be in about a month.
In your meetings with the governor's staff, do you feel that he's heard the message that we've heard from parents about their concern on getting schools opened up sooner rather than later?
I haven't had the opportunity to participate in any meetings as of late with the governor's staff. I know that our Washington State Department of Health leaders are meeting with the governor's office, and at the local health jurisdiction level, we have collectively conveyed what we have heard from our constituents in terms of desire to get school teachers prioritized and vaccinated as quickly as possible.
Okay, maybe one more thing here. Could you let the citizens know, now, you know, in the past, when I asked about ages and stuff, well, we don't want to talk about individuals because you could identify a particular patient if we gave out ages. But now that we've got 60 people that have succumbed to this disease, could the public know the ages of those individuals, or at least in brackets, that 80% of them were over 70 or whatever, some breakdown, because I do think the public is following this very closely, and I think they do have a right to know what age groups and underlying conditions and such are taking place here, both with hospitalizations, who's ending up going to the hospital, is it those with underlying conditions and a certain age, those that have died from it, and even the testing. Do we keep track of the age of individuals that we're testing? I mean, I see a lot of senior citizens that are very, very concerned about their situation in life and their possible limited time they've got here if we don't get this right. So is there any chance you could upgrade some of your information that you're giving out now that you were hesitant to give out earlier when we started with this information?
Yes, Commissioner Edwards, if you visit our COVID-19 data page, there is additional detail on there, and it does break it down by some of those details that you're looking for. So I encourage people to take a look at that. We will be adding some additional data metrics to our website soon, and I'll be sharing more information with you next week on that.
Okay, and just finally, I guess as a statement from my position, I'm very concerned the school teachers get ahead of the line here, because I think it's a big priority. We're never going to be able to accommodate those parents that are so distressed, and those children that are so distressed, whether it's physically or mentally, unless we get these teachers vaccinated, because they've said they're not going back into the classroom without it. So it's a mechanism for the governor to keep kids out of school as long as he can. So I would gladly forfeit my right to a vaccination to get a teacher in line in front of me. So I don't know how others feel about that, but we need to get those teachers vaccinated. So I'll call it quits there. Thank you.
Thank you.
Thank you very much, Shelley. Appreciate your time this morning.
Thank you.
we're going to move on to homeless strategies. We have Keely Marino, I see online. Well, good morning, Keely.
Good morning. Good morning, Keely Marino with Public Health and Social Services. I have a very brief report for you today. One, the Regional Housing Council is meeting this week. There is a link on our website to join if the public would like to join, and that's on Thursday at 4:30. So that's coming up this week. Big reminder that the point in time count will be occurring next week. It is a Thursday and Friday count. So the night in which we will be accounting for folks being outside or being unsheltered is the 28th, but we'll be doing the actual counting on the 29th. So looking forward to that being complete so we can gather a pretty thorough head count of how many unsheltered individuals are currently living in Thurston County. And then finally, just a heads up that the weather is turning a little bit. So according to the National Weather Service and Weather Underground, perhaps by next Tuesday or Wednesday, there could be some snow on the ground. Those weather reports tend to shift really quickly, either good or bad. And just a reminder that this year we'll be relying almost solely on shelter-in-place models through outreach workers to accommodate for those who are outside during cold weather, as we do not have extra shelter beds this month, particularly for single adults. There is room at several of the shelters, so that's good news. Families are taking advantage of shelter, absolutely, which is really great that we can offer that. But just a heads up about the cold weather coming around the corner. And that's all.
Okay, questions for Keely?
I do not, sorry, I didn't mean to interrupt, but I don't have any questions.
Nor do I, sir.
Keely, my only question was point in time. Are you, do you need volunteers? Are you flush with volunteers? Is there somewhere people could contact if they wanted to be involved somehow?
So it would be, this is just one of those years that we are not engaging with volunteers due to the COVID-19 pandemic.
Okay. Just want to make that clear. I know a lot of people come out on a typical year, so.
Right, next year.
Good to know. Thank you, Keely.
All right, thank you.
Okay, item number 3 is to review the draft agenda for this afternoon. We don't have a typical Board of County Commissioners meeting, but we do have a public hearing. And Ramiro, are we going to let folks know about the meeting we're having?
Yes, sir.
Why don't you outline that for the public, since it's an atypical Tuesday afternoon for us?
Yeah, beginning at 2:30 this afternoon, Thurston County is going to be participating on a nationwide event organized by the National Association of Counties, NACO. And this is an opportunity for all the jurisdictions across the county to acknowledge those individuals who have lost their lives as a result of the pandemic, COVID-19 pandemic. So this afternoon, Thurston County and the Board of County Commissioners decided to lower the flag today in memory of those who have lost their lives here in Thurston County. The Board of County Commissioners will convene a meeting at 2:30 where a message will be stated, following to a moment of silence for those for 1 second for each individual who have lost their lives in Thurston County. Unfortunately, last week we were tracking on maybe 59 minutes. We have 2 more deaths over the weekend, so that may be 61 seconds that you may consider having a moment of silence. Following to the memorial event at 3 in the afternoon, you have a public hearing where you will be providing public testimony related to amending the 2021-2026 6-year Transportation Improvement Program, particularly to revise the description of a project, 183rd Avenue Southwest, that will go between US 12 and Old Highway 99. The reason for this amendment, since the board approved the plan itself in December 18, Is soon after the board approved, we got the word from the County Road Administration Board that we would receive a little over $2 million in grants to improve this program. And it's important to make sure that we coordinate the limits of the grant with the official document of the Transportation Improvement Program before the County Road Administration Board approves the grant. So you will be receiving public testimony this afternoon, and for your consideration, we have two options for you. One is for you to consider closing the public hearing, and the other one is for you to consider approving the resolution amending the program. This is an option for you. Depending on the public testimony, I'd like to remind the board that if in fact, if you decide to take an action this afternoon, that action needs to be unanimous, and that is stated on state law.
Okay, this is the item that we moved up actually to try to kind of expedite this this grant recipient.
That is correct.
We have Scott Lindblom, our county engineer. Scott, anything, I know we went over this last week, anything you need to, that's changed or that you wanted to add?
No, Commissioner, it should be all set.
Okay, very good. Commissioners, any questions on the public hearing, first of all?
I do not have any questions.
No questions, sir.
Okay, and then just to remind the public that this National Association of Counties event that Maria described is at 2:30, which is a little bit of an atypical time for us, and we will be live streamed there. Moving into the public hearing at 3. No further questions there. I'm going to move to item 4. Thank you, Scott.
All right, thank you.
We'll move to item 4, which is a review of our draft agenda for next Tuesday afternoon's meeting, January 26th. Calling the meeting to order at 2 p.m. A pledge of allegiance to be led by Commissioner Edwards. Approval, a motion for approval of the agenda and board meeting minutes from January 12th and January 19th. Opportunity for the public to address the board. Any items that we should be aware of?
I am not aware of any particular items, but perhaps you may continue to have some testimony related to opening schools as well as vaccines. So that seems to be something might be coming up for your attention.
Item 2 is county manager's update.
I don't have anything pending, but certainly if something comes up this week, I will address that.
Okay. We have a number of consent items, A through F. 3A is delegation of signature authority to the county manager.
So thank you, commissioners. Let me give you a little bit of a background. Every year, the county submits the annual the ROC certification and all the related information related to all the expenditures that we have incurred in the previous year related to the gas tax that is given by the County Road Administration Board. Includes all the reports as to how the traffic law enforcement, road diversion, and all those elements. So, and this is a yearly event where we submit those reports to CRAB, County Road Administration Board, and the result of that submittal, we get a certificate of good practice. And the certificate of good practice allows to continue to receive gas tax dollars as well as grant dollars from the County Road Administration Board, and allows for us to continue to manage those dollars here in the county without any oversight from CRAB. Over the last 10 years, this particular documents and reports, which again is just an expenditure report from the previous year, has been signed by the county manager. As you may recall, at least Commissioner Menser and Commissioner Edwards, back in January 2020, the County Road Administration Board asked Thurston County to officially delegate that authority to the county manager to sign that documents, which you did, and you did via a motion, as you may recall. Well, this year, the County Administration Board has requested that you formally pass the delegation of authority via a resolution. So we're trying to catch up with the ever-changing requirements from the County Road Administration Board, and that is the proposal for you to consider taking an action next week to delegate the signature authority to the county manager. Again, this has been over the last 10 years. The last year, their perspective changed. This year, their perspective continued to change, and we'll continue to work with our attorneys as to how we can keep up with the ever-changing requirements from CRAB. That's all I have. And the last part was my editorial comments.
Okay, any questions from commissioners?
No, sir.
No, sir.
I don't think I do either. It's somewhat complicated, but at the same time, pretty straightforward. So thank you, Romero. We'll have that on our consent agenda for next week. Item 3B relates to the assessor's office. Resolution to reclassify position in the pay and classification pay plan.
Yeah, this is another step in the overall plan the assessor's office has to make sure that he aligns all the many different classifications to meet the business needs of his office. And in the past, you have taken actions to make sure that plan becomes a reality. In this particular case, the assessor is requiring reclassifying a senior appraisal position to an appraisal assistant. And this classification, again, meets the demands and meets the needs of the office. This particular action will reduce the budget from $6,023 a month to $4,719 a month. That will be a reduction of $1,304 a month, which is about 22% decrease. If you have any questions, I'll be more than happy to answer.
I also see the assessor is online. If we have questions.
Yeah, thank you.
Stephen Drew.
Didn't see it.
May I, Mr. Chair, may I be heard for a moment?
Yes, sir.
First, thank you for taking this issue up, and good morning, everyone. I just want to clarify that our needs are for a senior appraiser. We were unable to recruit one for a couple vacancies that we have. And so this request to downgrade the position to appraiser assistant is to enable us to compensate 2 new employees at their level of skill. We'll have a need that you're familiar with a year from now when the appraiser assistant becomes accredited after we invest 1,000 hours of training and the person completes classes required by Department of Revenue for accreditation. So I will be coming back to you in a year to reclassify this position back up to a senior appraiser. In the meantime, it does create savings within my approved budget, which will help me offset the budget cut for 2021. I thank you for your consideration.
Thank you, Steve. Questions for the appraiser, Commissioner Mejia?
Yes, actually. Assessor Drew, could you please clarify for us what were your 2021 budget cuts for this year?
Well, so we have a 2% overall cut. That ends up coming out of salaries because we, can't simply reduce interfund, and most all the rest of our budget, somewhere around $100,000, is devoted to mandatory mailings. So we're feeling the cut. We're not able to fill the FTEU authorized because we'll need to use that budgeted money to offset the cut at least halfway into the year.
Thank you for that.
Commissioner Ellis, anything?
No, I think if Mr. Drew feels he needs to do this, we shouldn't micromanage. So I think he ought to have that discretion. Thank you.
Okay, very good. I don't have anything either. So thanks for being here, Steve. Item 3C, Public Health and Social Services, will involve a resolution extending a position. I won't read out the number.
Yeah, thank you. Thank you, Commissioner. The Department of Public Health and Social Services currently have a 0.6 full-time equivalent of a community health nurse position. And the request is for you to consider extending this position until December 31st, 2021. As you well may be aware, as all of us are aware, the needs on public health are high at this point, and as many resources as they can get, they can certainly use it. In this particular, community health nurse will provide assistance to the overall response to families and as a result of the pandemic. There is enough funding to support this request, and at this point, the department is not requesting additional funding. And I believe Shelley is here if you have any questions related to this item.
Questions for Shelley from the board?
No, sir.
No, sir.
Shelley, just so I'm understanding, the position had an end date and it will continue to have an end date. We're just bumping that end date out for a year. Is that the?
Yes, that is correct. That is grant funded by our Department of Children, Youth, and Families, and they have a different funding cycle. So, yes.
Okay, I don't have anything else. Appreciate that. That will be item 3C next week. 3D is treasurer item, sale of tax title property via public auction, and we do have our county treasurer, Jeff Gadman, online.
Yeah, thank you, commissioners. This request is again, and that is a proactive approach that Treasurer's Office has gone through, making sure that all the tax title properties eventually get to the within the tax rolls. This particular property has been a tax title and exempt status since 1937. The office has determined that at this point, the best way to proceed will be for the board to authorize going to a public auction. There has been some background related to this particular property. And by the way, I have attached a map on your packet, so you have an indication where this property is located. It's located within the city of Rochester. There has been an indication that perhaps this property could be buildable, and that is the reason as to why the public action may be the best approach. The Treasurer's Office have done an initial estimation as to what the cost will be, and for your consideration, if you approve moving forward on this request, the initial bid price will be $25,564.50. That includes all the fees and associated with this transaction. Jeff Gadman, the county treasurer, is here to answer any particular questions related to this request.
Yes, I have a question.
Yeah, go ahead, Commissioner Edwards.
Jeff, could you explain a little more about this property? I guess what I'm looking for is if it's got possibilities, I'd like to have the public know about those possibilities in hope that we'll get as much money as possible from this sale.
You're muted.
Jeff.
I think about the time when you get back to meeting in person, I'll figure that out. Thank you very much for your time this morning, commissioners. I really appreciate it. This property is located just northeast of the central Rochester area in a plat called Rights to Rochester. And for whatever reason, this particular section of this plat has been very, very slow to develop over time. I know when I first started in the assessor's office back in the 80s, there was hardly any houses out there. Slowly over the last 20 years or so, more have been built. I'm not sure how we ended up with this particular property in tax title. It's been with us since 1937. The total taxes owing on it, by the way, are $28.98. So the property is flat. There has been building activity out there over about the last 20 years. I'm There are going to be some challenges to developing the property in terms of extending the water line. I'm not sure exactly where that's terminated now, but water is available. On-site sewage would be the option, so they'll have to go through the health department review of that. Obviously, the pocket gopher study. There's another study that I was not aware of before, prairie plant study that they'll have to go through. And in addition to that, the next challenge for anybody that buys the property is more likely than not, they will not be able to get title insurance on this property for at least 3 years. That's just a practice within the title insurance industry because this is a tax title that's being sold on a treasurer's deed. The current assessed value for 2021 is a little over $33,000. To address the challenges that might exist on this property, I'm suggesting an opening bid of 75%. I anticipate that this will probably get bid up higher than that. I can't, say what the property can be used for, but I will tell you that properties adjacent to this have been developed in recent years.
And how big is this property, sir?
0.49 acres, so just shy of half an acre.
So it's a half-acre lot?
Yep.
Yeah.
Okay, thank you.
Yeah, if water were not available, there wouldn't be enough room on this lot to have a well and septic. But because the Rochester water is available, they have room for a septic system. They'll still have to go through the health department stuff to determine if they can put an on-site septic system there.
Okay, thank you.
Jeff, my question is you've mentioned 33,000, but my sheet says 43,600. Is that a typo or is that a different number?
So the property value went down this year. In 2020, the value was 43,600. In 2021, it's 33,300. So the figure you've got was the 2020 figure from when we originally received the application from Mr. Van Rossum.
Okay, well, that answers that question. Thank you, Jeff. No other questions, we will move along. Items 3E and 3F are voucher lists. Are there any items that the commissioners wanted to need to have discussed here today? Not hearing any? No, okay. That's our consent agenda for next week. Item number 4 is community planning and economic development. Resolution regarding illegal discriminatory language in residential recording instruments.
Yeah, this item may be, I'm sure it's new for Commissioner Mejia, but not for Commissioner Menser or Commissioner Edwards. Late last year, I brought to your attention some of the language that there was included on the face of a plat. And those plats were, dated late 40s, early 50s, where they specifically has some discriminatory language related as to who can live in those particular developments. And I provided to you maybe 3 or 4 examples of that. You had good questions, really, if that is the tip of the iceberg or not. It was very difficult for us to determine how many of those are. And also, we staff committed that we will bring you a potential action for you to consider taking in order to address that particular issue. So for you today, we have a resolution the staff at CPED has developed for your consideration. But as a matter of background, back in June 12, 2020, the Board of County Commissioners wrote a letter to the community committing the county to, in part, explore how the board can institutionalize diversity, equity, inclusion, and justice across Thurston County government. In recent history, as I stated to you, recent history is late 40s, early 50s. There has been some plats approved by the county at that time, the legislative authority, that included that discriminatory language. And those covenants still exist. However, there has been some actions taken both at the state level as well as the county level to address that sense. In 1968, Thurston County, along the cities of Lacey, Olympia, and Tumwater, passed their own open house ordinances prohibiting unfair housing practices in the state in offering for sale, rental, and financing for housing, ensuring the equal opportunity for all persons who live in Thurston County. In 2018, the Washington legislature amended the law against discrimination, which is chapter 49.60 of the RCW. Allows for all real property recording instruments that is void under RCW 49.60224 to be stricken all the discriminatory language from all those properties. So the proposal before you today is, again, a resolution. And let me walk you through. You have a copy of that resolution, and I'm not expecting you to approve, obviously, today, but give you a copy to weigh in, and you adding any particular language. Page 4 of that particular resolution, and I'm going to read this out loud because that's the suggested legislative action that the staff is requesting for you to consider. Section 1. The Thurston County Board of County Commissioners hereby concurs that discriminatory restrictive language found in real property recording instruments against a protected class under Chapter 49.60 of the RCW on any real property or plats is contrary to law, offensive, unenforceable, illegal, and is unconstitutional, and as such, the board hereby disavows such language. Section 2, the board hereby supports the work of citizens, real property owners, homeowners associations, and other interested parties to find and rectify such discriminatory restrictive language in all real property and plat recording instruments in Thurston County. Section 3, if any section, subsection, sentence, clause, phrase, or other portion of this resolution or its application to any person in, for any reason, declared invalid, illegal, and unconstitutional, in whole or in part, by any court or agency of competent jurisdiction, said decision shall not affect the validity of the remaining portions thereof. And again, this is a follow-up to the item the staff brought to you late in 2020. And I don't want to take credit of this work because Josh Cummins and Jeremy Davis, which I believe is not here, did a lot of work behind the scenes, and I believe this is a good proposal for you to consider. Josh is here to answer any particular questions.
Commissioner Mejia.
I don't have any questions, but just a comment to Josh and Jeremy, just thanking them for your hard work on drafting this and looking into this.
Sure, you're welcome.
Commissioner Edwards, anything?
No, good job on staff's part. Thank you.
Okay, and yeah, I started looking into this myself after the meeting where it was brought, and I found that there were all this kind of convoluted history and attempts to address, and this looks like it's comprehensively gone through and kind of laid the history out, so that's useful. So I appreciate that, Josh. Thank you.
Yeah, I would like to thank you, County Manager and Commissioners. Just want to make sure that we're all on the same page. We have engaged with our legal counsel on this. All of the actions that the County Manager described previously make these discriminatory languages unenforceable, legally unenforceable. But to your point, Commissioner Menser, this is that comprehensive package that brings all of those together in one resolution for the board to really put a period at the end of that sentence and walk the talk. And so I wanted to just say thank you to the Board of County Commissioners for this opportunity to very clearly right a wrong that occurred in our past in this department, and to move forward. And to specifically say thank you to Jeremy Davis. He's on a well-deserved break today, but he's the one that worked to pull all of these different pieces together. You'll see that it's a rather long resolution, but it's important to make sure that we're clear and direct in what we're trying to accomplish. So thank you to Jeremy Davis. Thank you to the board for the direction. Looking forward to moving forward.
Very good. Thank you, Josh. All right. So that will remain on for next week. We have item 5, Public Health and Social Services, Health Care Authority contract regarding lead pilot site development.
Yeah, thank you,
Shelley and Marianne, but Ramiro, go ahead.
Thank you, Commissioner. This is an item the board, at least Commissioner Menser, Commissioner Edwards, have heard over the last few months. And there's a new item for Commissioner Mejia, so hopefully I can do justice and provide some perspective. The Washington State Healthcare Authority approached the county to see if we were interested in applying for a grant to implement the Law Enforcement Assistant Diversion Program, also known as LEAD, as a pilot project. The grant amount is for $925,593. And there was several conversations, as you may recall, Commissioner Menser, Commissioner Edwards, related as to how we can probably better implement this particular program. And this program will provide resources to establish a national recognized law enforcement assistant diversion program, also known as LEAD, and is an opportunity to have a community-based program that provide a systematic way for law enforcement officers and prosecutors to redirect individuals engaged in a non-violent, low-level crimes to services rather than deporting, arrest, and incarceration. It was a discussion in a couple of occasions. I believe the contract that is presented to you today meets all the criteria for this pilot program. And again, this pilot program will take effect as soon as the board takes an action, hopefully next week. And it will go all the way to June 30th, 2021, with the option to extend it until the end of 2023 if we have not spent the $925,593 grant. And again, Marianne O'Gara, I believe, is here, and as well as Shelley, to answer any questions related to this program. But I think it has come to a point for the board to consider accepting the grant and start implementing this pilot program.
Shelley, would you or Marianne like to add anything before I open it to the commissioner questions?
I don't have anything to add.
Marianne's shaking her head. Okay, any questions from the commission?
Yes, I do.
Go ahead, Gary.
Shelley, is this the piece that the sheriff was concerned about having people sitting on the roadside waiting for someone to show up? Are we talking about the same operation?
That is the same grant that we're talking about. Thurston County Sheriff John Snaza is a partner in this grant and did raise some concerns, but I believe we addressed those concerns in our collaborative meetings with the funder and the rest of the team.
Okay, then I do have a question about the 5th or 6th line down under the action section of that. It says site development to provide case management services through the LEAD program. And then it says for a total maximum amount of, and then the 925,000. I'm just wondering why that has to say that. Why couldn't it say case management services through the LEAD program for 925,000 and scratch out that for a total amount of? And the reason I say that, sometimes these grants, more money becomes available from maybe a failed grant elsewhere, but there was a certain amount of money in the pot. And then they get that out to us. And I just thought that was kind of limiting language. Just wondering if you had scratched that out, would it mean the same thing? And could it then make us eligible where we're kind of limiting ourselves? We're putting perimeters around here. I don't think we need to. Because if we're going to get more money, why not? That's my only question.
No, we can certainly scratch that to make it a little more flexible. I don't think has an impact on the action that you may consider taking.
I mean, does that, what I'm kind of trying to get across, does that make sense? That,
yep, absolutely.
Is that okay with my seatmates and such? Okay.
I don't have any questions.
Okay, Mary Ann, I'll just ask you, I've been kind of tracking this along a little bit, and any 11th hour curveballs in terms of there's been back and forth in the contract and trying to make sure that we're in compliance with the requirements, and anything to report from the last, say, month or two that shifted in any kind of major way that the board might not be expecting?
I would say no. Everything, concerns that both we as Thurston County had, our partners had, they had, Healthcare Authority, have all been addressed prior to this. I feel the time spent in this negotiation and these discussions has been well worth our time, so that we are starting from a really good place, and do in fact believe, from everything that I understand, we will have the opportunity to receive more funding, as was just stated. So for Thurston County, we are starting on a really good footing. And so curveballs from that angle, no. Any program like this, we need to be flexible, adaptable, and know that we need to be paying attention and address the needs of both law enforcement and participants. But from where this is going, the time was well spent that we spent getting to this point.
I have one other question, sir.
Go ahead.
The dollars that are coming into Thurston County, who are they coming from?
The Washington State Healthcare Authority and from the Substance Abuse Block Grant. So that, in essence, opioid response type funding.
So it's federal and state grant, is that right? Well, then I would expand my recommendation to get rid of that 10% thing down there too, because if it's money coming in, wouldn't we want to do everything to receive as much of it as we possibly can if other jurisdictions slip a little bit? County manager, is that?
My recommendation is to leave the 10% because this is a brand new program, and I think it will be prudent to see the results of this pilot program. If there is an additional money, I think the conversation is going to be not just limited on additional money, but it's going to be perhaps expanded as to how this program can evolve and grow down the road with additional money. So I understand what you're saying, Commissioner Edwards, but at this point, I think it is a prudent approach to keep 10%, because the conversation of this, it will be larger as a result of seeing the outcome of this pilot program.
Okay, thank you.
Amir, I see that Under Sheriff Brady has joined. I don't know if he has here for a different item or if he's here for this item.
No, Under Sheriff Brady is here for the executive session that you have, they will have scheduled for later today.
Okay, very good. Well, I just kind of say to wrap this up that there's a number of kind of criminal justice issues that are kind of working through our system. And this is one that probably the community should be most excited about in terms of its potential to really shift the focus from what I've heard the community wants to see, which is, treatment, health issues and mental health issues and substance use issues treated to the extent possible outside the criminal justice system, but being addressed. And this is a way to do that through a program that's been well, worked through at the national level and in other jurisdictions, and has a lot of support behind it, as Marianne has explained in previous meetings. And since the Undersheriff's here, I just say for his benefit that we will do, I will commit to doing anything necessary to make sure that they are comfortable with how it's working and that it works for them. And I've already been speaking with the prosecuting attorney and defense about how we can make that happen. So just reach out and I'll reach out and we'll just make this work for Thurston County. I'm really excited about it. Thank you, Mary Ann and Shelley, on that. Item 5B is also public health, and it's a 2021 treatment sales tax interlocal agreement with the Thurston Mason Behavioral Health Administrative Services Organization.
Yeah, thank you, Commissioners. This is a yearly agreement. The board has exercised your legislative authority, and this is to issue treatment sales tax funds on the order of $2,500,033 and to the Thurston Mason Behavioral Health Administrative Services. This particular agreement goes from January 1st, 2021 to December 31st, 2021. You had these conversations during your 2021 budget development process, and the programs and the activities the Thurston Mason Behavioral Health Administrative Services Organization, I will not spell the acronym of that anymore. But, and again, it will serve both youth and adults with behavioral health needs and are delivered in a variety of settings, including schools, juvenile detention facilities, and the Thurston County Corrections Facilities. There's a community-based treatment facilities and program serving individuals experiencing homelessness as well. And again, this is a yearly allocation from the treatment sales tax. And this is just a formal action the board needs to take in order for us to transfer those funds. Carrie Hennon, the manager of the treatment sales tax fund, is here to answer any questions.
Yes, I do.
Yeah, go ahead, Commissioner Edwards.
What was our total amount that we brought in on the treatment sales tax for 2020? What did we end up with?
Good morning, Commissioners. Carrie Hennon, Public Health and Social Services. And Robin can correct me if I'm wrong, but I believe that because of the way we are now accruing sales tax revenue, that I cannot give you a final answer on 2020 revenue until something like March, because the February and January will be accrued back to 2020. The 2019 revenue was $6.4 million, and we, as of the last month of revenue, we were on track to be up for the year about 4%, I would say.
A follow-up to that. Our treatment sales tax community board, I guess, that helps us make those decisions, were we able to meet all of the requirements or suggestions that they made for us as a board to look at? Were we able to fund those?
Yeah, so in the budget process back in the fall, we talked about this several times. So I presented on behalf of that advisory committee a recommendation. You as a commission discussed that a couple of times and basically accepted their full recommendation with one minor change, one minor addition that did not relate to this particular contract, but you added something in the pretrial services area. But yes, you basically accepted the full recommendation of that advisory committee.
Okay, and I don't want to put you on the spot because I'm not sure who knows the answer to this at this point, but I'm still going to ask it. Can you give the public an example of a real success story that came from this $2.5 million expenditure in the past, that just so we could say, you know, here's what we're doing, and we're doing some good things?
Yes, we are doing lots of good things. So as Ramiro mentioned, this funds a lot of different programs in several different settings. I probably can't give you a specific client-focused success story, but there really are some, I guess, some of the programs I would highlight. So there's a program that provides substance use disorder treatment in school settings to young people who might not be able to access those services elsewhere, and that includes in all parts of the county. And even now with schools closed, that program, those therapists are operating in the school building so that young people don't have to go. They can come get face-to-face services even now with precautions, and it's, in their home communities. So that's one program I would highlight. Another program I would highlight is the Intensive Case Management Program, which is one of the longest running TST funded programs that has substance use disorder professionals going out into the community, really helping to find people who are not seeking treatment on their own, conduct a substance use disorder assessment and connect them with usually inpatient treatment. And they're able to do that with, I'd have to look at the data, but 150 people a year who they assess and get a bed date and get them to that treatment. So lots of great programs funded through this agreement.
You're going to have to wave something there, County Manager.
I think Ramiro's raising his hand. Yeah.
His hand.
Yeah, and a specific example of a success of this program, last year, the then Commissioner Hutchins featured a commissioner production to TC Media, where he specifically had a conversation with an individual who was involved in some of the different programs with the Thurston Mason Behavioral Health Administrative Services Organization. So it was in a specific feature in which an individual involved within the program, it was a success story. So let me do some research, and I can probably share that with you, Commissioner Edwards, because last year it was one individual highlighted as a success story.
No, I actually saw that. No, and I think that was great. I was just wondering for some kind of a little cheerleading sketch about we're spending $2.5 million. I thought maybe we could just come out with something, boom, here's an example, but that's okay. I knew I was going to be putting somebody on the spot if he didn't have anything right available, but maybe another time. Thank you very much.
I do have a question, Chair. And this is just for my information only. So I see this is Thurston Mason. Does Mason County also put in $2.5 million, or how does that work out?
So Mason County, so our agreement funds services only in Thurston County.
Yeah.
Mason County does have its own version of a treatment sales tax. They do work with the TMBHASO. I am quite sure it's not $2.5 million. They would fund, they, of course, being a smaller county, have much less funding, but and I guess your seatmates who are more involved in the BHASO may be able to speak to, how the extent of that partnership, but they do also partner with the BHASO, but our funds only fund services in Thurston County.
Thank you for that. And then how is that $2.5 million figure chosen? Yeah, please.
As the county manager mentioned, this has been a yearly agreement that has gone up somewhat over time, though we're pretty much flat with last year. And then you heard references to our treatment sales tax advisory committee. So the Board of County Commissioners appoints a group of now 9 community members who meet on a monthly basis and learn everything there is to know about treatment sales tax, and there's a lot. And they run a pretty extensive process of developing a budget recommendation to the county commissioners. So through the regular county budget process, offices and departments, and kind of pursuant to the terms of the separation agreement between the county and the Behavioral Health Administrative Services Organization, the BHASO, they all make their funding requests to the county, and then all of that is reviewed by the Treatment Sales Tax Advisory Committee. They look at data, they look at historical spending, they look at program models and evidence, and they come up with this recommendation. And then we as staff present that to the county commissioners. So it's, and the total of all the funding that they requested for these roughly 10 different programs was this 2.5 million. Does that help?
Yes, thank you.
Sure.
Okay, thank you, Carrie. I would just add for Commissioner Mejia's benefit that the Thurston Mason Behavioral Health Administrative Services Organization covers Mason, but it can certainly contract for work that applies only in Thurston County, and it has that ability. It's not required to spread its work across, the two counties if that's not the financial arrangement and the contract that's at issue. There's that flexibility, so that's what's going on here. Let's move to item 6, which is Public Works. Interagency Services Agreement with Washington State Department of Fish and Wildlife for Boston Harbor.
Yes, thank you, Commissioner. And let me take you back to Commissioner Menser and Commissioner Edwards. And this is related to the maintenance of the bathroom and the parking lot located on the boat launch in Boston Harbor. No news, but we have, some struggles as to how the Parks Department within Public Works has been able to provide maintenance to those facilities. And a couple of years ago, the board approved an interlocal agreement where the Department of Fish and Wildlife will contribute half of the cost of maintaining those the bathroom facilities as well as the parking lot. And this is for your consideration a renewal of that particular agreement. And again, this is a small amount. I believe it's $5,000, where the Fish and Wildlife, the state Fish and Wildlife will participate on the maintenance. And this will be on an annual basis for 2021 and 2022. And Karen Weiss is here to answer any questions, I believe. Or maybe Lucy.
Lucy Mills is there. Commissioners, any questions on this item?
I do not.
And I do not either, sir.
I don't either. Thank you, Lucy and Karen. Next is also Public Works resolution vacating unopened rights-of-way in the plat of Boston Harbor.
Yeah, for your consideration, Commissioners, is for you to approve a resolution adopting the hearing examiner's recommendation for a right-of-way vacation in the Boston Harbor area. In November 10, 2020, the board held a public hearing related to a proposed request for a vacation of portions of the county's right-of-way known as unopened 69th Avenue Southeast, again, within the Boston Harbor area. There were no comments received on this particular testimony. The next step is for you to consider approving the resolution to take into consideration the hearing examiner's recommendations, subject to the payment and compensation. So that's the normal process. If the board approves this particular resolution, then Craig Season will make sure that the appropriate compensation will be taking place. And then he will come back with an additional action for you to confirm the final vacation. And Craig is here to answer any particular questions related to this proposal.
Questions?
I do have a question.
Yep.
Craig, is this one we're just kind of finishing up on that we've been kicking around for the last 6 months or so, and it's from like 100 years ago or something?
That's correct. This was a 1907 plat, and this is one we're cleaning up. This is, I believe, the third time this has come before the board.
Okay. No, I have no other questions. Thank you.
No questions from me.
Okay. These are kind of, I'm sure Craig would answer any questions offline. These are kind of a little bit complicated to understand. I remember my first time seeing it, I was a little confused as what was going on, but it's pretty straightforward on this particular one. As Craig said, we've reviewed this a number of times. Okay, with no other questions, thank you, Craig.
Thank you.
The last item, substantive item on next week's agenda is under County Manager, and it's our old friend, the Comcast franchise agreement.
Yes, Commissioners, this is a follow-up to the briefing you received last week related to the franchise with Comcast. This franchise will go for 10 years, and this has been a regional effort. You heard from Ken Feldman, that was the attorney that we hired, is to help us go through this process. As you can imagine, negotiating any type of agreement with this large cable provider such as Comcast requires a team effort. And the team effort was formed between the cities of Olympia, Lacey, Tumwater, and the county. And that has taken a little while to get to this point. As any agreement you heard last week, it requires a give and take. And I believe this is a good agreement as to how we need to continue to coordinate efforts with Comcast as they use the county's right away to provide services to county citizens. This is for 10 years. And if you have any questions, I believe that briefing was last week. Robin and I are here to answer any questions.
Any questions on this side?
I do have one. I don't know.
Go for it.
It's a question, a statement. I had asked during that briefing if there was any possibility of getting some type of funding to help TCTV succeed, because they're going to be facing some problems. I guess I'll just put it that way. And his response was that the cable company doesn't like it, but he feels it's legal to do it. And that's where you recognize a sponsorship for a segment. And undoubtedly the sponsor contributes something for that recognition. And I'm just wondering if at some future time, I mean, I don't want to hold this up at all, but I just bring it up because at some future time, if that wouldn't be worth an agenda discussion on our part, on the Board of County Commissioners' part, to see if we can't help TCTV stay viable, because I notice that the Washington State, what's the name of their same thing? I mean, TVW does exactly that. They recognize sponsors somehow. And so even though our attorney thought maybe they wouldn't like it, but it sounds like it might be doable to help TCTV stay relevant in our community. So I just bring that up.
May I?
Yes.
Yeah, certainly. The board will engage in many conversations related to TC Media. What you may recall from last briefing related to the franchise agreement with Comcast. Comcast used to cover the lease of the current space that TC Media uses, and that was no longer an option for Comcast. And as a result of that, also Comcast agreed not to charge any lease payments to TC Media until December 31st, 2021. So you're right. And this year, the board needs to exercise conversations as to how we're going to be moving forward related not just the future of TC Media, but also how we're going to be ensuring that we provide services to every single meeting that you hold here as a board. So more to come on that. And but you're right on point. I think there is something the board will definitely engage in many conversations as we move along into this year.
Robin?
I would also add that every year the county pays about 1/4 of what we collect from the franchise agreement to TC Media. Last year we paid out over $300,000, plus we pay half of the PEG fees that we collect to TC Media, and that comes out to be about $40,000. So we do contribute already to TC Media.
Just as a follow-up on that, sir, my concern there would be that if we were able to implement something like I mentioned, we might be able to utilize that money in some other area, even though it might be dedicated. We might be able to expand our horizons, so to speak. If we did not have to pay that out, we could use it for something else here in the county of similar nature.
We would have to change our contracts with TC Media. It is part of our contract.
Right.
Anything,
I'm always trying to save money for the taxpayers. That's what I'm looking for.
I do not have questions. Thank you.
Okay. At that point, then we will do our standing items of reporting on commissioners' items, county manager reviewing schedule, and adjournment. It's 10:23, and I'm going to call for a...
Before you move away from this agenda, there's one additional item that may be coming for your consideration, and that will be the Medic One agreement. And you heard via briefing last week on the TCOM Medic One TCOM 911 agreement. So that might be coming for your consideration as soon as we have the attorneys review that in a local agreement. So that might be an item that might be added to your agenda next week. But again, it's a follow-up to the briefing you received from TCOM 911 last Tuesday.
I remember a briefing about the finance portion. This is different, though. What is? Can you remind me what this interlocal agreement relates to?
Yeah, the briefing is that we need to revise the agreement that we have with TCOM 911. As you know, the voters passed a sales tax. The TCOM 911 is going to go through the process to upgrade the radio system.
Oh yeah, there were just little changes.
From analog to high definition, and as a result of that, you know, all the equipment for all the first responders will be updated on the individual units. And you had a conversation related to how we're going to be replacing those equipments down the road. So again, this agreement is needed just to continue on with that process.
No, I remember it now. Thank you, Ramiro. Okay, it's 10:25. We're going to be in recess till 10:35. At that point, we will have 40 minutes to complete the rest of our agenda.
Yeah, so thank you.
At that point.
Undersheriff Brady.
Okay, I didn't.
There you go.
Okay, very good. We're back in session for the Board of County Commissioners agenda setting work session for January 12th. And we're picking up with item 5, proclamations and awards. We have Clerk of the Board, Amy Davis, to go through this with us.
Good morning, Commissioners. Amy Davis, Clerk of the Board. There are no proclamations for review today, but the 2021 proclamation schedule updated with Commissioner Mejia's request last week is included. So if any others come up at any time, please just let me know and we will get those added.
Okay. And advisory boards and I know we're going to address that later. So let's move to advisory boards and commissions. Do we have, I see a couple of new folks on this list.
Yes, there are 3 applications reviewed last week for John Bordon, Robbie Rutledge, and Juanita Torman, all for the Agritourism Advisory Committee. There are also 2 new applications. The first from Peggy Kwan, a reappointment for the Civil Service Commission, and City of Tenino Council Member Cutter Copeland for the Solid Waste Advisory Committee to carry out the remainder of the term left behind by the prior City of Tenino representative. If there is any direction for the 3 applications received last week, I will take that and we can get those included on an agenda.
Okay, do commissioners have questions or anything to sort of, any comments regarding these 5 pending applications?
No, I do not.
No, sir, I have no questions.
Ramiro, what's the proposal here? Are we going to maybe put these on an agenda in February for approval?
My recommendation for at least the Solid Waste Advisory Committee for you to consider that next week, since this is an appointment by the City of Tenino. It is just for you to confirm. And the other appointments, early February when you have the opportunity to review the applications.
That sounds like a plan to me. Sounds good. Okay, yeah, City of Tenino, we have a letter in the back of the packet showing that they're recommending Mr. Copeland. So that's good. Let's move to PIO check-in, item 7.
Good morning, Commissioners. Megan Porter, Public Information Supervisor. The kiosk system that I've been talking about the last month or so is now live as of this morning. A news release has gone to the media and the homepage is updated to reflect this. The plan is to go live in other buildings in February, assuming 1 building each week. This is an estimated timeline based on the ease of installation and testing for each building. But an implementation of this magnitude would usually take a year or so. So IT's been doing a great job pushing through this quickly and working through the unanticipated issues. And then sent an updated version of the e-signature policy to legal for review with some questions based on the feedback I received. After legal review, I'll send this through the policy work group and then get it back in front of you guys for review. I'm hoping that I'll get this to the policy review work group in the next week. Pending any questions, that's all I have for you.
Anything from Megan?
No, sir.
No questions for me.
Thank you.
Thank you.
I do not either. Thank you, Megan. And we're moving quickly because we do have an executive session for the last chunk of this morning meeting, and we have a hard stop at 11:15. The legislative update is next, item 8.
Yeah, let me walk you through briefly to the report that is included in your packet. And we have highlighted and read the new bills for your consideration. Those are mainly the result of the Washington State Association of Counties bills. They're in support, or perhaps they are neutral, or they have some concerns with it. I am not going to go down each one of them just because of the time constraints. And my suggestion will be, if you have any questions related to this, let me know, and I can bring those to next week. But I will certainly keep you posted if any of those become an issue. I did review the recommendation, and I'd like to probably for you to flip to page, will be 1, 2, 3, 4, and that is House Bill 1152. And that is something that we have already discussed last week, and it's related to the proposal of implementing comprehensive public health districts. WASAC is in opposition to that. And again, Commissioner Menser can probably elaborate on that. He attended the legislative meeting, I believe, last Friday. And I'd like to confirm that, in fact, the county is aligned with the position of WASAC related to this bill. That's one.
I'll just say for myself, I did not have the opportunity to have any other than the WASAC meeting I attended, but in terms of some additional legwork that I wanted to do on this bill, I didn't get a chance to do it. So I'm personally still in a neutral position regarding this. But that's my 2 cents.
Okay.
I'm just not there yet.
Commissioners?
There's I can report there was strong opposition from WASAC Legislative Steering Committee based on the, just mainly about the combining of mainly about the combining of counties into larger districts. That seemed to be the focus of the conversation. There's a lot of pieces to this, but in the eastern counties, some of these, in order to get I think the state's trying to make them roughly equal in population. And so in order to do that in the littler counties means that more counties get combined that are further apart from each other physically. And, there was talk about how, there'd be 3 hours drive between certain places that would be combined in a single health district. I don't know, that just seemed to be the focus of the WASAC discussion last week.
Okay.
I do have a concern. Could I comment, sir?
Mm-hmm. Yes.
I guess my concern is similar to what my concern is with what's going on this COVID district consolidation, where we end up, or potentially we end up being penalized for, I don't know, inaction, misdeeds, whatever it is, of some other entity that we have absolutely no control over. And that's why I agree with WASIC on this particular situation.
No comment from me. I need to look more into it.
So what I'm hearing, that perhaps I'm hearing neutral and concerns. So will the position of the county on this bill will be to remain neutral and see how the position of WASAC moves forward?
I mean, it sounds like you've got two neutral thumbs at this point. I mean,
Okay.
like I say, we can revisit this.
And I will keep you posted as to how this moving.
How about this? How about this? You have two neutral thumbs and one opposed thumb. So how about giving a neutral minus?
We can develop that at scale.
Okay, that'll be your new criteria.
Yeah, one last bill for you to read and consider. In the same page, if you go up to the top, the second is the House Bill 1Y32. It is concerning the protection of water supplies for farming and rural economic development. That's an interesting piece of legislation, and WASAC has concerns related to that. And I believe the concern is a little bit contrary to the Hearst decision, and because it deals with water rights associated with farmlands. On the surface here, it appears to be beneficial to farmlands, but I think it's going to create a conflict with the Hearst decision in the wires they're continuing to implement. So my recommendation is to align those with WASAC's position. And those are the key highlights considering the time that we have. If you have any other questions, and certainly I will keep you posted.
I do not.
I'll just make a note. So we've got 1132 and 1152. Those were
Yeah,
I'll make sure that I review those in a more comprehensive fashion. Hopefully my seatmates can do the same and can take this up next
yeah,
week.
and I will keep you posted again if anything materializes as a result of the public hearings.
Okay, thank you. So now we're down to our last half hour, and I know we wanted about that much time for executive session. The county manager had proposed to postpone Commissioner Item 1 for next week on the Water Conservancy Board. Is that acceptable to my?
Yes, sir. That doesn't have any deadline. In having a conversation next week, I think will be appropriate.
Is that okay with commissioners?
Yes.
Okay, then public testimony, other commissioner items. Can we move then straight to the executive session? Is there any other comment or need? I skipped over the briefing, public hearing, decisions pending.
There's none. Yeah.
Okay. So let's go to Commissioner Item 4, 10-4 executive session pursuant to RCW 4230.1101A little 1 to consider matters affecting national security regarding Inauguration Day protests. Commissioners' action may follow, and we anticipate about 28 minutes.
Yeah, and Commissioner, as soon as you complete the executive session, you need to reconvene just to make sure you close the meeting.
Okay, well, let's do a 25-minute executive session. So we can
Under Sheriff Brady, are you available?
I am. Yep, I'm ready.
Okay. Let us close the video feed. Let me close the